Hi, I'm Garrett Winarski, massage therapist. I just want to talk to you today a little bit about the issues that infants can have. I see a lot of infants in the clinic, youngest being 17 days old that I saw. I also see my own kids. Kieran, he's 5 months old now, and I started working on him when he was around 10 days old. So there's many type of issues that um, the infants can have, essentially. It can be more spine related, more pelvis related. Sometimes it's more digestive related. So we need a good history, talking with the parent as to what the complaint is. The biggest word today is colic, but colic is kind of it's like using the word stress. It doesn't mean a whole bunch until you actually start talking about it. So is the kid not sleeping? Does the kid not want to sleep on their back? Can they not sleep on their stomach? Have we switched from breast milk to formula, which may cause a little bit of a change in the digestion? Or are we going from breast milk to now solid food, essentially, which that can also impact the digestion. The intestines work with a peristalsis action, which is a squeezing type of motion to move the food and waste through the intestine. Sometimes that can get really backed up, essentially. So how often is the kid pooping? Sometimes they haven't had a bowel movement in 3 or 4 days. So then the descending colon comes on the left side of the pelvis of a child. So then if the pelvis can be totally, shifted and arched, you can see how a little bit of a shift in the pelvis causes him to react. So when we can assess that, and take a look at the pelvis, take a look at what's happening with the spine, take a look at what's happening with the digestion, we can formulate a plan and do some treatment for that to correct that dysfunction, let's say. So the theory that I use is when we have delivery of a baby, there's approximately a 10 centimeter opening, and the baby's pelvis and head can be approximately 10 centimeters as well. So the analogy, if you have a 10 centimeter square cardboard box and you're trying to move this through an opening, you can totally shift and compress a cardboard box because it's pliable. Same thing with the baby's pelvis. So you can move that cardboard box into a diamond shape, let's say. So after delivery, a couple days, weeks, does that diamond shape shift back into its original square position to allow the intestines to work properly, etc.? Usually it does, there's no problems. But if that positional change from delivery does not reset, then yeah, the kid is going to be shifted. The pelvis is going to be shifted. If my kid doesn't sleep, my kid doesn't eat, my kid is crying all the time. So we start getting these symptoms and frustration for the parent if they're not aware of the symptom and the cause, essentially. So those are some of the things that I see. Sometimes kids are delivered super quick, 6 minutes, from first contraction to the baby coming out. So the impact, the pressurization into the pelvis and the head is just like squashing this kid and then torpedoing him through the birth canal. That's not how it's meant to happen. So then it can take several weeks, even 2 months, before the kid actually starts having the problem. But we need that good history, the good communication from the parent as to what are some of the symptoms, and let's look at the causes of them as well. So one of the things that I do first is check the alignment of the pelvis, and just to make sure that everything is lined up straight. So as we take a look at the belt line and just seeing if one hip is shifted, potentially the right side, if the colon is influencing the pelvis, definitely this is shifted. Into the gluteus, I'll do a little rotations, right side, some rotations, and just get a palpatory feel of what's happening in this baby's pelvis. Sometimes I'll do some traction, some light stretching, both sides. So as I stretch his left side, he's quite okay. As I go to stretch his right side, then he kind of starts squirming, right? As he does not like that side, but left side, perfectly fine. So that's, one difference already, that we have to kind of take a look at what's happening on this right side, essentially. A good way to calm kids down is some tempotement. So I'll do some shifting to get them to calm down, both ways like this, from the side, and I'll get some onto the back, a little bit more relaxed. Again, we'll just do a little bit of traction in through his pelvis. Can definitely roll the baby over. Check the pelvis from the front side. We can do some motions on the left anterior hip. We can do some on the right anterior hip. Again, we can do some stretching. Right side's nice. Left side as well. Check things out in through here. As well, checking strength. Like, can they pull on both sides essentially? You know, how are they doing for sitting up motion as well? And then just, you know, doing some pelvis rotations, checking for that as well. In conclusion, that's just a brief overview of what I do in the clinic, essentially, of how I assess infants, the communication with the parent, and the light treatment. I don't call it massage, like I'm not using oil and massage. It's just kind of a light type of mobilization. Again, screening tests, if something's not right with the child, I'll refer out to a physician. If something is more serious, and I think they do need to have more assessment done from a physician or another professional, by all means. But it's also just calming for the parent, talking to somebody who has a couple kids, who has had issues with their own kids, and when I can offer that insight and help calm them down, help calm the kid down as well, everyone's better. The kid is calmer, parents are calmer, and usually it's one treatment. The odd time, kids need to come in a second time, but usually one treatment is very effective to help the child. And then again, maybe you know, if I see a baby at 2 months, maybe at 6 months when they start solid food, we have to see them again. But other than that, it's quite effective to do just a little bit of work for the infants, just to kind of get them growing, get them healthy, get them sleeping better, and it works wonders for their life and for the parent's life. Thank you for your time. Garrett Winarski, massage therapist.